Hello, my name is Ross Arena, and I'm professor and head of the Department of Physical Therapy at the University of Illinois, Chicago. I'm very pleased here today to discuss an upcoming publication in the Mayo Clinic Proceedings that will be jointly published in the European Heart Journal. The title of this publication is Healthy Lifestyle Interventions to Combat Non-Communicable Disease, a novel non-hierarchical connectivity model for key stakeholders. This policy statement was sponsored by 4 professional organizations, including the American Heart Association, the European Society of Cardiology, the European Association for Cardiovascular Prevention and Rehabilitation, and the American College of Preventive Medicine. Each association contributed distinguished authors to the writing group, and I had the honor of chairing this policy statement. As we all know, non-communicable disease is a global healthcare burden, and we need to have a paradigm shift in how we address prevention and secondary treatment once an individual is diagnosed with a condition such as cardiovascular disease, diabetes, or pulmonary disease. We are recommending the paradigm shift intricately include healthy lifestyle interventions and integrating that into the medical model. We are advocating that healthy lifestyle interventions are in fact medicine, and there is a wealth of literature to demonstrate that. But we are also extending beyond the traditional healthcare model and identifying all key stakeholders and their role, describing their role in the fight against non-communicable disease, and ideally the prevention of non-communicable disease. So this includes, for example, the government, public school systems, community organizations, as well as traditional healthcare, health insurance providers, and so on. So in this policy statement, we described and identified each stakeholder and described their role or how they can help combat non-communicable disease. And we admit this is not a novel approach. This has been done before. Other publications have described the role of each of these stakeholders. But we took it one step further and actually described the connectivity and the collaboration which can enhance healthy lifestyle interventions. We also recommended that these stakeholders work in a non-hierarchical fashion, collaborating on an equal playing field and being creative in how healthy lifestyle interventions can be moved forward. So that is really the novelty of this policy statement, and we hope that it gains some traction with countries around the world. Admittedly, this is a European and U.S. initiative as described by the sponsoring organizations, but we feel that our approach creates a great deal of flexibility, allowing for any country around the world to adopt this model, and that is in fact our hope. We also described some examples of how this non-hierarchical connectivity model can work. Not all stakeholders are needed for each initiative. Again, there's a lot of creativity built into that. And we also provided a section identifying barriers and challenges to implementing this model. But this is not a comprehensive description of potential models or potential barriers, but something that is hopefully thought-provoking and allows stakeholders to move forward in a collaborative and creative fashion. To conclude, we do know healthy lifestyle is a key approach to preventing non-communicable diseases, and also once an individual is diagnosed with a non-communicable disease, to help prevent secondary events and improve outcome in the long term. Although there is a lag to adopting that into traditional healthcare. But the true novelty of this policy statement and what we are truly excited about is the way that we have connected the stakeholders and we have encouraged them to work moving forward. We also advocated for healthy lifestyle ambassadors, that each of these stakeholders identify healthy lifestyle ambassadors formally within their organizations to champion healthy lifestyle initiatives moving forward. Because truthfully, without individuals who are invested within these organizations and committed to healthy lifestyle interventions and collaborating, there will not be much traction, we feel. So we feel that that is an important piece to this. So thank you for your time and attention, and we hope that you enjoy this policy statement, and we hope that it makes a meaningful change in the way we approach non-communicable disease prevention and treatment moving forward. Thank you again.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.